Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am super excited to tell you that I am here today with Dr. Bert Vargas. Hello, Dr. Vargas, how are you?
Hi, good, Lindsay. Thank you so much for the invitation. It's a real honor to be here with you today and have the chance to talk to you and your listeners about Think, Talk, Treat migraine.
Well, thank you so much for coming. Today, we are going to discuss, as Dr. Vargas just said, a project that Dr. Vargas is involved in called the Think, Talk, Treat Migraine Program that's sponsored by Eli Lilly. This is an outreach program. I thought it was really important to go ahead and dedicate an episode of Heads Up to this program because of how much it can help our community. Migraine is so underdiagnosed. And those of us that are diagnosed with migraine often do not have an adequate or appropriate treatment plan in place. This is well known. There's a lot of data to back this up. And this program that Dr. Vargas is involved in is out there to sort of help this problem. And if you are an advocate in the community, we're going to talk about how you can introduce people to this program in your community and help everyone out. So let's learn what this is about. Dr. Vargas, just so that our listeners know a little bit about you, can you start by telling us why you are so passionate about working in the field of migraine?
Well, the background on my interest in migraine goes all the way back to residency, and it was at that time that I realized that the degree to which people with migraine are stigmatized and misunderstood, and how much of an impact you can make on their lives, sometimes by making small changes, definitely by just listening. And so through that, I found this population of people to be just incredibly rewarding to work with, and I decided I wanted to dedicate my life to the care of people with headache and people with migraine in particular. Interestingly enough, it's the part about listening to the patient that's being so high yield, and the way that kind of circles into the importance of communication, as well as the understanding that there are over 37 million people in the United States with migraine, 1 billion worldwide, and just a little over 500 headache specialists that really identify an enormous gap in care. And so on the back of the communication issue was really the unmet need issue that really called out to me as being an area where I can exert an enormous degree of change, or at least I hoped to. I still hope to, and it's also what really ties in very well to the Think, Talk, Treat messaging, really being about communication and about being unmet needs. So I feel like I've come full circle.
Okay. So what is the overall goal of the Think, Talk, Treat Migraine program?
Well, at the end of 2020, just to give a little bit of background, our medical affairs team at Lilly was asked to identify unmet needs in migraine, and then to construct an initiative to address those needs.
Okay.
And our North Star, really what we used to guide us, was a study that is called Overcome,
Okay.
which is a Lilly-sponsored multi-cohort cross-sectional longitudinal web-based patient survey that now has over 60,000 people enrolled. And
it's very
through
big.
it's enormous study.
Right.
And what we found were two very important issues. Number one, many people with migraine and migraine symptoms are just not being identified as having migraine.
Yes.
And the second being that a lot of people with migraine who are eligible for certain treatments, whether it be acute treatment or preventive treatment, are just not being identified.
Right.
And this contributes exactly to what you mentioned earlier, the overall problem that migraine as a disease state is underrecognized and undertreated.
Right. I mean, I can say I do believe it's better for people now, but I had chronic daily migraine from the time I was 4. I wasn't diagnosed till I was 17. I didn't have an adequate treatment program until I was 30. So I can understand that. I do believe we have a lot more medicines available now, which is very helpful. And we do have headache specialists now, which is very helpful, but we still are underdiagnosed and undertreated. So I do think this is hugely, hugely important. Does the program only involve outreach for patients, or is there a component for healthcare providers?
Well, it's a very global program in the sense that it is for both patients and providers.
Okay.
And what you mentioned just a moment ago, really your journey
Mhm.
is not uncommon, right? Where we
Mhm.
have people who spend many years of their lives sometimes not knowing that they have migraine,
Right,
and sometimes with their providers not knowing they have migraine,
right.
and not necessarily having access to the treatment that they need. And so,
Mhm.
again, a call out to overcome. We have identified that among 20 people, so if you take a group of 20 that are impacted by migraine,
Mhm.
only 13 of those 20 actually make it to a healthcare provider.
Okay.
And in that group, there's only about 10 that actually end up with a diagnosis of migraine.
Mhm.
Again, among 20 people with an impact of who are impacted by migraine, only 6 patients who are eligible for acute treatment actually get that acute treatment, and only 3 in 13 that are eligible for preventive treatment get that preventive treatment. So what we're looking to do, to your question about who is this for, we're trying to essentially put patients and providers on essentially on a level playing surface where we can connect those dots, right?
Right.
Uh, Providers to activate the knowledge base that they have, patients to be able to express the journey that they're going through,
Mhm.
and the symptoms they're experiencing, and hopefully connect those dots somewhere in the middle to lead to better outcomes.
Right. Okay. This sounds awesome. I really do. This is why I wanted to make sure we had an episode on this, and I hope everyone's listening on how to sort of get this out there in their community. So Heads Up has sort of a diverse audience. We have a lot of seasoned chronic migraine veterans who listen. We also have people who have debilitating headache conditions that aren't migraine who listen. And then we have some people who are brand new on their headache journey that are our listeners. So regardless of where you are in your headache or migraine journey, I'd like to invite everyone to head to thinkmigraine.com. If you can, if you're driving, you can do this later. And we're going to explain how the Think, Talk, Treat Migraine program works. So Dr. Vargas, on the Think Migraine website, people with migraine can click on Think, Talk, or Treat. And let's start with the word think. What is it that the person with migraine symptoms should be thinking exactly?
Yeah, it's a great question, and I love that there are some very specific calls to action for every single one of those components to the program.
Mhm.
The think part of the initiative is really about distilling the diagnosis of migraine down to 4 important symptoms, that
Mhm.
being headache, light sensitivity,
Mhm.
nausea, and impact of those symptoms on one's life.
Mhm.
Meaning that they would be so severe, those symptoms being so severe that they would impair them from functioning at full capacity. These symptoms are part of a migraine screening tool called ID Migraine,
Right.
which is a registered trademark of Pfizer, and is actually a way for providers to efficiently and more important, accurately come to some conclusions about what their patient is experiencing. So if a person has headache and 2 of those symptoms, there's a greater than 90% chance that they have migraine.
Mhm.
And that number goes above 95% if they experience all 3.
Right.
Um, Again, a call out to efficiency. This is really meant to address the needs that many providers have, that there's at least the perception that they don't have the time to go through an enormous amount of detail with their patient about migraine. And this is one quick way to get to that conclusion and perhaps open the door to some more detailed conversations.
We talk about people who have migraine but aren't going to see a provider. I think that a lot of those people are those who have a family member who has severe migraine, and they're comparing their head pain or their attacks to them, and they're like, well, I'm not as sick as her, so I don't need to go to a doctor. And so I think this tool is really important, because that person is going to be like, well, hey, I'm getting all these headaches with these symptoms. Maybe I do need to go in. And I love the fact that we can reach those people with this ID migraine tool and with these questions under that think button. How about talk? What is it that the person with headache symptoms should be saying, and who should they be saying it to?
So the talk is really about people with migraine being open to the idea of talking to their providers about impact, and being honest about the true number of days that migraine is affecting or impacting their life.
Mm-hmm.
So too often, and I've seen this so many times, even among the most savvy of people with migraine,
Mm-hmm.
is that there's a tendency to minimize those days where symptoms are maybe not as severe.
Yeah.
And there's a tendency to underreport them or just not report them at all, being completely unaware that really those numbers are significant to a provider, as they're frequently used to help make treatment decisions and also assess response to treatment. Um, on the provider end of this, it's also about providers talking to their patients about the full scope of the impact of migraine. So not just about pain, but about the other days that migraine and the other components of migraine
Mm-hmm.
are having an impact on their life. So
Mm-hmm.
it's truly about getting a big picture of what a person with migraine is experiencing.
Right. And I think that we tend to fall into the trap of, a lot of people don't understand. They'll get, maybe 2 really horrible days a month of migraine where they're in bed. And then they have a bunch of days that they don't quite know what that daily headache is. And I think it's important that they talk to their physician about all those headache days, because I've noticed that people will go in and just talk about those 2 days and think that that was their migraine history and that's it. Right. How important is it that they talk about all the days?
Exactly. And to some degree, there's even a minimization of those days where people are not experiencing migraine or symptoms of migraine, but they're concerned about when that next migraine is going to happen.
Right.
And it's just interesting to see how, even in the absence of the cardinal features, the cardinal symptoms of migraine, that it's still having an impact on someone's life and how they're conducting their normal activities and experiences throughout the day.
Mm-hmm. So the last word, obviously, is treat in Think Talk Treat. What is it that you want people to know about migraine treatment?
Well, I think the important points with the treat component are that it's important to treat migraine early and effectively for
Mm-hmm.
better results,
Mm-hmm.
and having the knowledge that the effectiveness, or at least searching to engage in an effective treatment plan, has the ability to impact a person's ability to engage in normal daily activities.
Right.
It's also a call out to the fact that treatment is really not one size fits all.
Right.
That this again is about communication between provider and patient, and about them mutually agreeing on an appropriate treatment that is individualized to their specific needs. So again, this is not about any one treatment. This is about really getting people the care that they need, whatever that is.
Okay. So we mentioned that there's a component to the Think Talk Treat Migraine program that is reaching out to physicians, providers, primary care physicians. What is the goal of this component of the program specifically?
Well, we identify primary care as really being truly on the front lines of migraine care.
Mm-hmm.
They see the overwhelming number of people with migraine. And so it's important to address their needs in the
Mm-hmm.
care of their patients just based on sheer numbers alone.
Right.
And for instance, if we just talk about people who are in a primary care office, regardless of what they're there for, 29% of those people in the primary care waiting room have migraine as a comorbidity, no matter what they're there for.
Right.
And interestingly, if someone has headache and they present for an outpatient visit, 94% of those individuals will have migraine as the cause of that headache. So clearly there's a need to make sure that migraine is identified.
Mm-hmm.
Now, the other issue that we see providers of all specialties face, but especially primary care, is that they have a very limited amount of time
Right.
to work with a patient that perhaps has a number of
Yeah.
potential health issues. And so it does limit the amount of time that someone can spend really unraveling some of the some of the details that someone might come in with.
Mm-hmm.
And that's why something like ID migraine can be very effective at just being a very quick screener that takes only a few seconds to help better identify the people that are coming in with symptoms that might be migraine and help kind of improve the diagnostic accuracy at that visit.
Right.
I
I
think it's also, oh,
Go
I'm
ahead.
sorry. Go ahead.
No, go ahead. Please finish.
Yeah, no, I was also going to say, it's important to kind of distinguish what we're trying to do from a number of education initiatives that are out there for primary care.
Mm-hmm.
Uh, and I think that that's a call out to the importance of our primary care colleagues, that there are so many initiatives out there. But what distinguishes us is that this is not really an education initiative as much as it is an initiative to really help providers utilize the knowledge base that they have. As I mentioned earlier,
Right.
uh, primary care providers, they actually can do an excellent job at identifying and treating migraine. And I think where those unmet needs occur is when those communication the communication between them and their patients breaks down to some
Right.
degree. And so this is really meant to kind of help facilitate that communication. And so it's certainly not meant to point fingers at either the patient or the provider at
Right.
as the cause of those unmet needs.
Right. I think that the strength of this program is it educates the patients and it educates the provider. And then if you get them together in the same room, I think you're going to have a spectacular outcome. And so that's what I saw as a strength when I was learning about this program. And I also always try to get out there. I tell people, it might not be that, obviously, no matter what you're there for, always tell your doctor about your migraine, your head pain, or whatever, but it would be best to make a special appointment for your headaches or your migraine and not just tell them about it when you're there because of your diabetes or whatever else, because it does warrant its own appointment. It's always very helpful, is something that I always like to say. If we have, this is an important question because I know we have a lot of them out there that listen. For our migraine patient advocates that are listening, that work so hard for the people in their community who have migraine, if they would like to introduce physicians in their community to the Think, Talk, Treat Migraine program, what should they do? What advice do you have for them?
Well, I think the best first step would be to introduce their provider to thinkmigraine.com.
Okay.
So that's our website, and that's
Mm-hmm.
where both patients and providers will find resources specifically tailored for their needs.
Mm-hmm.
So in the provider portion of the website, providers will be able to engage with our materials, download ID Migraine, find some of the educational offerings that we have coming up at large primary care conferences and even online webinars So that's where I would start is directing them to the website.
Okay. And would you do the same thing if, there's people out there who want to educate themselves, or they know patients that probably have migraine, just send them to the website?
Yeah, I would definitely send patients and people with migraine, and even people that have migraine symptoms but aren't yet diagnosed as having migraine, to the website
Okay.
to educate themselves on the diagnosis of migraine, the treatment of migraine, and what they can do to help facilitate that communication with their providers.
Great.
Again, this is not necessarily an initiative that is about the people who are savvy experts, like many of your listeners who have been in the healthcare system
Right.
for many years, as much as it is to engage them and their ability to be advocates
Right.
and to help those friends and family members that they may know that have not yet taken that step
Mhm.
in realizing they have migraine or have not yet fully advocated for themselves to seek better treatment. This is a way for them to help engage with those people that may not be as experienced in living with migraine.
Right. Okay. So as a reminder to everyone, in case you didn't hear it, or you were driving or whatever, the website's thinkmigraine.com. Dr. Vargas, is there anything else you'd like to add to our discussion of this program before we go?
Well, I again can't thank you enough for the opportunity to speak with you today, Lindsay. It was a real honor for me. I think the only other thing that I would include is really just the summary of the program, right?
Mhm.
And I give all the credit to my colleague Helen Hostetler, who came up with this great mnemonic, because this is a lot of information. But
Right.
if I had to give a 1 second pitch for what we're trying to do, it's really
Right.
about the 411 of migraine. So those of you who are my age and older remember 411 being information. You
Oh,
call 411,
right.
and it's about four key symptoms. So
Mhm.
headache, light sensitivity, nausea, and impact on someone's life that
Right.
helps with the diagnosis of migraine and really calls out the ID migraine tool. One key question, and that's about impact, the number of days that migraine impacts your life,
Mhm.
and the relationship between that question and then the next step, which is one key answer in terms of being, if it's 1 day a month or more, that's a person who's likely a candidate for acute treatment. And
Mhm.
if it's 4 days or more in a month, then that's likely a person who's a candidate for both acute and preventive treatment. So that's the 411 of migraine, and really what I want to leave everyone with today as being the take home.
All right. Well, thank you so much. And thank you for being here. What a great episode. And I think we're going to be able to help a lot of people. And thank you, everyone, for listening. And please join us again next week for the weekly webcast and podcast of the National Headache Foundation.